From the News Channel 5 Network, this is OpenLine.
Hello everyone, welcome to OpenLine tonight. Tough topic, but very important topic. We are talking about suicide, the level of suicide nationally, also here in Tennessee. What can be done to lower the numbers? Tennessee ranks 18th in the nation when it comes to the number of suicides. Over 1,000 in the latest year that we have figures. It's a massive problem that does not get enough attention. I'm sure it has affected many of you. We want to talk about it tonight in a new program to try and lower the number of suicides in our state. Happy to have with us a good group up here. Granger Brown, a volunteer with Tennessee Suicide Prevention Network. Thank you, Granger, for being with us. And Samantha Nadler? Oh, thank goodness. Okay. Samantha Nadler, who's with a regional care coordinator, also with Tennessee Suicide Prevention Network, and Scott Ridgway, the executive director. Thank you all for being with us. And Scott, I want to start with you. All with Tennessee Suicide Prevention Network. I want to get into the numbers that I kind of laid out there, but what is the Tennessee Suicide Prevention Network?
Well, the Tennessee Suicide Prevention Network is a grassroots organization that really kind of gets to the grunt work of trying to address suicide as a problem. When we lose 1,017 individuals to suicide on an annual basis, we really need to be able to have people out there that are teaching folks the warning signs, giving out information, and really trying to make sure that people really know that there are warning signs out there. Probably about 14 years ago, the Tennessee Suicide Prevention Network was established. The Surgeon General, Dr. Satcher, created a national strategy for suicide prevention, and Tennessee answered that call. We work closely with the Department of Health and the Department of Mental Health and created the Tennessee strategies for suicide prevention, which are kind of blueprints that the network follows and so forth. Our state's divided into 8 different regions. We are a public-private partnership. We're not a not-for-profit, and we're not a state agency. We are considered a national network across this country because of all the work that we've accomplished, and you will hear about some of the work that we've done.
Okay, so you're not a state agency.
Correct.
Public-private, just describe that briefly. What does that mean, public-private?
Well, public-private is that we really want the private sector to be involved. Suicide affects a lot of folks, as we have said, but the reality is by putting the public and private sectors together, we're able to implement strategies in order to reduce the numbers of suicides. If we just pretend and we just said, no, this is really the private sector, we really need folks interacting and being involved. And so, as I mentioned earlier, where we have 8 different regions across the state, we also have an interstate departmental group that meets monthly, and that's representatives from every state department and state government, and we are working with those folks to be able to look at strategies and activities and outcomes that will come out of those state departments.
1,017 people. Is that unusually high? How does that rate as far as the number of people in the last reporting period, last 2013, that committed suicide in Tennessee?
That's the most numbers of suicides that have been reported in Tennessee.
Ever.
Correct. And that's based on per 100,000. You just mentioned that we are 18th in the nation, one being the highest. So when we look at those numbers, it's per population. When we look at those numbers also, on an annual basis, we lose an average of about 20 to 25 teens, the ages of 10 to 18, to suicide on an annual basis in our state. And then when we look at the numbers 19 to 24, we have an average of about 75 more young people that die by suicide. But if we're really going to tackle the issue, we're really going to have to look at our middle-aged Caucasian male is the demographics that really make up the folks that are dying by suicide in our state.
Middle-aged white men.
Correct.
Are most, I guess, at risk.
About 68% of those deaths out of the 1,017 are that middle-aged Caucasian male. Correct.
And why is it, and I want to bring in both of you in a moment here, but why is it so bad? Why are we seeing more suicides than we've ever seen before? What do you think's going on?
Well, I really have to say, and we applaud the Department of Health, this administration really believed in putting in some extra money in the budget for the Department of Health, where they have a full-time state medical examiner that really helps work with all the 95 county designees and medical examiners that actually will pronounce the individual that has died by suicide, and education has played a big role. We hope this year those numbers go down. One suicide is one suicide too many, and so I think establishing that office where there's a full-time person working with those folks, it's very important. And you might ask the question, why would a suicide not be reported? It might be that there's not enough evidence. There's still the stigma that's out there that's associated with suicide. There is not enough insurance may not be given when someone dies by suicide, and so we're seeing a lot of those areas change.
How important, and I'll let both of you come in with this, the stigma. There is this stigma that's out there. People don't want to talk about it, and so when we don't talk about it, these kind of things, they just get worse and worse and worse. Why is there this stigma? How alive is it? How do we get past it?
Well, we've had stigma since forever, okay, but since about 400, when the Catholic Church ruled that suicide was not appropriate for all the martyrs, okay? But we see stigma with every part of what we do, whether we're training people, whether we're trying to help people, when we work with survivors. We have groups throughout the state for people who've lost somebody to suicide, and one of the things they consistently report is even their friends don't know what to say, so they don't say anything, and they remove themselves, and the person who's already feeling isolated even feels more isolated due to this stigma. So part of what we try to do to overcome that is to just make people aware of suicide and encourage it to, we think of it normally like other diseases, other conditions we deal with all the time.
And you're a coordinator, regional coordinator. What about this issue of stigma?
I think that the silence perpetuates the stigma further, because there's this unwritten rule that says, you're not supposed to talk about it, so you better not talk about it. And I think when you are going through something that can't be seen and can only be felt, over 90% of people who die by suicide have a diagnosable mental illness, so I think there's a lot to be said about that, and the stigma that comes with having something that is disabling that can't be seen or touched. And when you can't talk about it, you can't look at it, it's very hard to verbalize. And again, that silence that comes with it communicates that you're not supposed to talk about it, so people don't.
And that's why we're glad to be on the show tonight, to start getting people to think about it. If there's somebody who's out there thinking about it, we're going to put up the National Suicide Prevention Lifeline telephone number in a few minutes. That would be a place they can call 24 hours a day to reach out for help. And we always want to encourage people who are having problems. I mean, you don't have to be suicidal to call the suicide line. You can just want to talk to somebody about your problems.
And it's so tough. To talk about it, it is tough. People have thoughts from time to time, and so at what point is it dangerous, and at what point do they need to take action? And I bet there are cases where someone may have a thought and they think, oh, this is nothing, I don't need to do anything about it, or they hear someone say something and they're like, oh, they're just talking, they don't really mean it. When you start going down this road, at what point, what are the real warning signs, and when should people really be concerned?
Well, I think there's a lot of different types of warning signs out there, whether they're verbal clues of someone saying that I wish I were dead, or I'm going to kill myself. There may be situational clues that the individual may be a lack of irregular activity, a disinterest in their faith, or there may be some other clues. But I think that most important we need to realize and we need to stress is that anytime someone out there picks up on some type of clue, we need to take all signs seriously. That's really important, because I think sometimes where we see something on Facebook or we see something where we've been texted and there's several other people that have made a statement or expressed something that their intent is not wanting to live, is we really need to try to explore what's going going on with that individual.
And this is where that stigma comes in. People don't know what to do, and because of the stigma, they don't do anything. And many times the person has given somebody notice that they're thinking about this, and either directly or indirectly, like Scott was talking about. And so one of the things we always want to do, if you have just the least gut feeling that somebody's thinking about suicide, ask them about it, have them reach out for help, give them support. It's amazing. We've worked with people who've had incredible histories of engaging in suicide behavior, just have bad things happen, and yet when they get the support they need, they don't have to go to that place where they're engaging in the suicide behavior.
And before we go to break, you said there is a stigma, obviously.
Oh, yes.
Is the stigma less among young people? Are you seeing that? And I want to ask you that.
Yes.
I mean, is the younger generation less likely to have this stigma or not? I mean, is it just that doesn't make any difference?
I think the stigma is definitely different, but I think also the implications of stigma are different too, because you don't think about the same things as an adult that you do when you're going through that in high school. You know, when I was in high school, I struggled a lot, and I didn't struggle with stigma among my peers, but it was with my family that I really battled that, and that still contributed to why I couldn't verbalize the need for help. So I think it just depends on where it's coming from. I do feel like it was easier to talk to my peers, but they didn't know what to do with that, so that wasn't necessarily helpful either.
Right. And I want to talk more about your personal situation. And we're going to start taking some phone calls here. We have to take a break. Several people on the line. If you hold on, we will get to your call. Be back right after this. We're also going to talk about a new program that's being instituted by the Tennessee Suicide Prevention Network. So we'll take a break. Be back right after this.